name is John Silvani. I'm coming to you from INSA, INSA Global and INSA USA. I'm doing a presentation on opioid overdosage. I'm a registered nurse, certified addictions registered nurse, certified addiction specialist, and a licensed counselor, but I also have a fellow in the Academy of Addiction Nursing. INSA is a global organization, and we tend to work with addictions nurses all over the country, but we also want to bring on other people that may want to be collaborating with us. Our organization's been around since 1989, and we continue to strive for excellence in the field of addictions nursing. Opioid overdosage. How has the use of fentanyl and carfentanil changed the game and made treating opioid use disorder difficult? Well, a parent's worst nightmare is getting a call at 3 a.m. and the phone rings. Already your heart skips a beat. Is a police officer. Mrs. Smith, your son was taken to the hospital. He may not make it. Your mind goes to, what happened? Was it an accident? Was it a car accident? No, ma'am. Your son overdosed on fentanyl and did not respond to the Narcan given him at the scene. We used Narcan to bring him back, but your son didn't respond, so he's going to the hospital. I suggest you get there. Many parents did not even know their child was using opioids. There's confusion, there's hurt, and scared to death. Happens all over the world daily. Opioid use can lead to death due to the effects of opioids on the part of the brain which regulates breathing. Opioids slow breathing. An opioid overdose can be identified by a combination of these three signs and symptoms: pinpoint pupils, unconsciousness, and difficulties with breathing. Worldwide, about 500,000 deaths are attributed to the drug use. More than 70% of these deaths are related to opioids, with more than 30% of those deaths caused by overdose. According to the World Health Organization, estimates approximately 115,000 people died of opioid overdose in 2017. And in 2018, 2019, 2020, and 21, it's gotten even worse. Opioid overdoses that do not lead to death are several times more common than fatal overdoses. So just because they have an overdose doesn't mean they're going to die. They may be on a ventilator or in a coma for the rest of their lives. Fentanyl and other opioids. What are we talking about? The number of opioid overdoses has increased in recent years in several countries, in part due to the increased use of opioids in the management of chronic pain and increasing use of highly potent opioids appearing on the illicit drug market. In the United States of America, the number of people dying from opioid overdose increased by 120% between 2010 and 2018. During this time, opioids were used for the fifth pain relief. And 2/3 of the opioid-related overdose deaths in 2018 in the USA involved synthetic opioids, including fentanyl and its analogs. During the COVID-19 pandemic, a further substantial increase in drug overdose deaths was reported in the USA, primarily driven by rapid increases in overdose deaths involving synthetic opioids. Fentanyl is a potent synthetic opioid that is used as a pain reliever and as an anesthetic. It is approximately 50 to 100 times more potent than morphine. Fentanyl in various formulations is on the World Health Organization model list of essential medicines. However, fentanyl and its chemically similar analogs, including carfentanil, acetylfentanyl, butafentanil, and fentanyl, have been associated with a spike in deaths from opioid overdose. There is evidence that drug dealers may be adding fentanyl to increase the potency of their products, such as heroin. There's not evidence it's happening. And selling fentanyl as a counterfeit drug may look like authentic prescription medication. Therefore, many users who test positive for fentanyl and its analogs realize that they have taken a substance and the substance is fentanyl. Carfentanil is even more potent, 10,000 times they're saying. It was used for elephant tranquilizers in the past, and now it's being used by people. And fentanyl has a half-life of 4 hours, carfentanil 7 hours. Risk factors for opioid overdose. There are a number of risk factors for opioid overdose. These include having an opioid use disorder, not in treatment for this, taking opioids by injection, resumption of opioid use after an extended period of abstinence, Let's say you were in a place that treated opioid addiction for 28 days. When you come out, you'd have low tolerance. Following detoxification, release from incarceration, cessation of treatment. Using prescription opioids without medical supervision, using while alone. Always use with a partner who has Narcan available. I'm not encouraging people to use, but if you are going to use, you want to have someone there that could bring you out if you do happen to overdose. High prescribed dosage of opiates, more than 100 milligrams of morphine are equivalent daily. In the state of Ohio, we have a what they call an opioid risk factor when they report the ORS, which is our pharmacy reporting system to see if patients are using more than one pharmacy to get opioid-type drugs. Physicians and patients need to moderate using opioids in combination with alcohol and any other substances or medicines that suppress respiratory function. Using opioids in combination with that can cause death. Benzodiazepines, barbiturates, aesthetics, or some pain medications. Having concurrent medical conditions such as HIV, HCV, which is very common in injecting opioid users, liver or lung disease, or mental health conditions. Emergency responses to opioid overdose. Death following opioid overdose is preventable if the person receives basic life support and the timely administration of the drug naloxone. At times, me and one of my nurses have always been on the lookout for this, and we've had to revive people in the past, and it's not fun. Naloxone or Narcan is an antidote to opioids that will reverse the effects of an opioid overdose if administered in time. Naloxone has virtually no effect in people who have not taken opioids. So if you make a mistake and you think he's having it's an overdose, may not be an overdose, but if you give them the Narcan, it will not affect them. Access to Narcan was generally limited to health professionals for years. In many countries, there is still limited availability of naloxone, even in medical settings, including in ambulances. On the other hand, some countries have already made naloxone available in pharmacies without prescription. In the United States, in some states, you can get it. In Ohio, you can get it without a prescription. Several countries, Australia, Canada, Italy, United Kingdom of Great Britain, and Northern Ireland and Ukraine, have introduced naloxone as over-the-counter medication and have also started proactive dissemination in communities. In the United States, especially Ohio, gives Narcan to behavioral health and substance use programs for free to give to their patients along with medicated-assisted treatment. What do I do if I see an overdose? People most likely to witness an opioid overdose are people who are going to be at risk of an opioid overdose themselves. So people who use, always use with a partner if you use. Again, friends and families of people who use opioids on a regular basis. Narcan saves lives, remember that. Healthcare workers, the emergency services, people providing accommodation to people who use opioids, and peer education and outreach workers, as well as others whose work brings them into contact with people who are at risk of overdose. How can we help prevent overdose? Prevention of opioid overdose, beyond approaches to reducing drug use in general in the community, there are specific measures to prevent opioid overdose. These include increasing the availability of opioid dependence treatment, including for those dependent on prescription opioids. Methadone treatment works well, Suboxone treatment also, Vivitrol or Naloxone also works. Reducing and preventing irrational or inappropriate opioid prescribing. If you hear of a physician who's easy, ask what is that? Monitoring opioid prescribing and dispensing is important. Report bad physicians, pill mills, or dealing of opioids in the community. Encourage MAT treatment, medicated-assisted treatment. Patients in medicated-assisted treatment using methadone or Suboxone are much more likely to avoid overdosing on fentanyl. Patients who leave treatment overdose within 2 weeks of no treatment, quite often the next day. Prepared by always having Narcan with you. Call community health or county health department for free Narcan. Many places will train, and we train people on how to use Narcan. It's pretty simple, and online you can find many sites that'll tell you how to use it. Most lay people will use Narcan that's inhaled through the nostrils, and it saves lives by being proactive. Carry Narcan with you. Encourage treatment. Keep an eye on your child because you will see different signs in them. If you see them sleeping inordinately much at home, actually eating at the table and falling asleep, it's called nodding. Nodding is a sign that they're using opioids. And educate your child. Don't lie to him. Don't tell him that he's going to turn into a monster or see green monsters. Just tell him that he could die using opioids. If you do have to use opioids, always have a partner, always have Narcan, and be prepared to have a partner that knows how to use Narcan. Dependence happens to a lot of people. It doesn't matter if you're a doctor, lawyer, or somebody from the street. You can get dependent on opioid drugs, and you can die from overdose. Please understand that this is not to scare you. This is happening. Opioid overdosage in the state of Ohio has gone crazy. I have some references, and you can read those, but I also want to tell you that none of what I say is anything that has to do with INSA USA or INSA Global. It's my opinion, and I just wanted to get this out to those that did not know much about opioid overdose. I am a addiction specialist, and I've worked in the field of addictions for 32 years. I run a treatment program called PACS Treatment Program in Middletown, Ohio, and we treat methadone with methadone and Suboxone. And we specialize in treating opioid addicted or opioid dependent mothers who are pregnant. We've had much success with that over the years, and we will continue to work with people. We feel that in treatment, there's a good chance that we will keep them from overdosing and they will live productive lives. Remember, it can happen to you, it can happen to your son, it can happen to your family. Be careful when you're using opioids, even for accidents. When you have an accident and you're prescribed it, be very careful, because it will slow your breathing down, and if it slows your breathing down, you may not wake up. Thank you for listening to me, and if you have any questions, feel free to contact me. Again, my name is John Silvani. I'm a registered nurse, certified addictions registered nurse, certified addiction specialist, and a licensed chemical dependency counselor, and a fellow in addictions nursing.